Ask the Doctor with Michael Lange begins in 30 seconds. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Authored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
All righty. Good morning and welcome to Ask Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins, here each and every Saturday morning live to answer any and all questions you have regarding your vision, eye care, any nutritionally related topic. So now's the time to pick up the phones live and give me a call at 1-877-969-8600. 1-877-969-8600. A lot of you have been listening to Ask the Doctor for close to 30 years. I started hosting this show back on a small radio station in Ocala, Florida, April of 1993, nonstop. I had a daily talk show here, drive time, 9 o'clock in the morning, every single day, including Sunday, in the Tampa Bay area for many, many years. And now you're picking us up on Saturdays, Sundays, and Monday nights. And of course, my co-host is Dr. Richard Hall, better known as Doc Hall from Ocala, Florida. Doc Hall heads up the Lange Nutrition. He's an integral part of the Fortify Vitamin team, the research team, the advisory board. He's a good friend. He's an icon in the sports nutrition world. And we're going to talk to him in just a few more minutes here, a few more seconds, actually. So we got a lot to talk about today. Today's an exciting show. You know, it's the new year. Everybody should be having their New Year's resolutions in full swing, right? Everybody should be getting down to their ideal body weight. Everybody should be trying to lose weight if they're overweight and gain weight if they're underweight, right? And so there's a lot of different things out there we can do. Certainly going to the Fortify website has a lot of educational tools for you to learn how to build muscle, how to lose weight, how to get in shape. Go to fortify.com. That's Fortifeye. Remember, I'm an eye doctor. Fortifie, fortify.com. We're going to talk about atherosclerosis today, or hardening of the arteries, or arteriosclerosis. Three words that kind of mean the similar things. We're going to talk about ways you can naturally lower this atherosclerotic plaque in the blood vessels that increases your risk of a sudden stroke or a heart attack, or a fatal heart attack or a fatal stroke. So we got some really exciting studies out there, some exciting information about a supplement that actually is good for your heart, your brain, your eyes, your joints, your circulation, your blood pressure, healthy cholesterol, healthy triglycerides, good for your skin, hair, nails, mental and cognitive abilities, and good for your muscles. And what is that supplement? Of course, Bob, who's on hold, would know what that supplement is. And of course, that's omega-3. Omega-3 in the triglyceride form, or the reesterified triglyceride form, not the stuff you buy over the counter, because that has ethanol in it. So that's a lead into what we're going to be talking about. We're going to talk about inflammation of these arteries, which is called atherosclerosis. We're going to talk about inflammation in the body that causes pain. Many of you out there have arthritis, have autoimmune diseases, collagen vascular diseases. You have trauma, you have joint pain and body pain from trauma. So there's a whole host of reasons that you're in pain. And we're going to talk about some things that you can do naturally to help alleviate that pain. This does not replace medical evaluation or your drugs. But one thing that's near and dear to my heart all of a sudden is autoimmune diseases, things like lupus and arthritis and mixed connective tissue disease, sarcoid, scleroderma, fibromyalgia, et cetera, et cetera, et cetera. We're going to talk about dietary adjustments and supplements that may be beneficial. Never replaces your drugs, though, but may be beneficial. All right, phone lines are open. 1-877-969-8600. That's 1-877-969-8600. I will be today about 12:30 at the Fortify Nutrition Center. This is right there on McMillan Booth Road in Clearwater, Florida, in the Publix Plaza. It's called the Bayside Bridge Plaza. I will be there 12:30 to 2:30 or 12:30 to 3 today, talking nutrition and having a lot of fun with all of our regulars and a lot of new people that will be coming in. All right. Good morning, Dr. Hall. How are you? What's on the agenda for today, my friend?
Good morning, my friend. We had a good talk on the way in this morning, and happy Saturday, by the way, to all of our listeners. We're glad you're here with us. Pour that extra cup of coffee or that cup of tea and just sit back for the next hour and maybe learn some things along the way, get motivated along the way, and we're going to talk about those New Year's resolutions. How's everyone doing with that, by the way, with your New Year resolutions, or as I prefer to say, positive lifestyle changes? That sounds better to me. The first 2 weeks, folks, are always the most difficult when you're trying to make changes, not just first of the year, but any time during the year. If you decide, to give up cigarettes, give up alcohol, give up a poor diet, it usually takes about 2 weeks and it kicks in. So you have some, little trying and rough days that are going along the way, but it will be worth it. So please, just hang in there. It's going to get better, I promise. Something that you might want to try, and that's putting together a personal vision board. That really helps a lot with you to focus and stay on goal. It'll help you stay on that wellness path. It really will. A vision board, if you don't know, it's kind of like a bulletin board. And you can pin up photos and inspirational quotes. And even a lot of people go to magazines and they cut out, photos of a house, of a car, or something that they want in their life. And, you have to have a vision of that. You have to have a pure or a clear path for that. And so create a little vision board. But the trick is to put it in a place that you see it every day and hopefully 2 or 3 times a day. So it reminds you, just don't pass by. That doesn't do any good just to create it and then let it sit. A lot of people put them on their phones, on an app and stuff. Well, how many times a day do you go to that? You probably don't go to it at all. So just make a little bulletin board or, just pin things up and be focused on those. And, it will help. I did that with a lot of pro athletes. And then I kind of morphed it into doing it with pro team. And they got a team vision type thing, and it works. But we have lots of good things going on. I'm working on a special pain relief formula with Dr. Lange. We've really been putting some time in on that this week. A lot of research. We're both kind of tired today. We were talking about it on the way in. Energy is there and stuff and mental and like that, but you just, it's a lot to come up with. It really is. And Dr. Lange's going to be at the Clearwater store today, and I'm going to try to get over there in the next week or two too. So, we'll give you a little update on that. And when I come over, we're going to do like a little exercise session. So, we'll tell you ahead of time, and you can wear your sweats if you want to, and do a little bit of exercise with Doc Hall if you like. And so that's coming up too. But we got a big show today, and I already look at the board here. I see, we got our favorite up there. Bob's going to be that first caller. I got a good feeling.
Yep.
So, back to you, Dr. Lange.
All right, Doc, we're getting loaded up. We got a lot of people on hold. We're going to go to Bob first, and then Chris. Chris, hold on. We're going to get to you very quickly, and also Mandy. Bob in Ocala, good morning. Welcome to the program.
Good morning, doctors. I suppose the first question, is this live or is this Memorex?
We're live for sure, Bob.
All right, good. All right. I hope Memorex didn't throw you for a loop. That's an oldie but a goodie.
I remember that from the good old days.
Yes, they are. All right. My question today, actually, it kind of sounds like it's going to melt right into what you're going to talk about today. I've been reading some articles based on NO, nitrous oxide, and its natural form is beets. But the article that I read took a graphic picture of a brain, a person before and after implementation of nitrous oxide. It must have been a thermal imaging machine of some nature because it showed the difference between circulation in the brain before and after the nitrous oxide. My question is, if this vasodilator will open up and increase blood flow, would it not therefore, in my thought, be the go-to solution to high blood pressure?
Oh, absolutely.
It just seems,
Yeah,
it just seems to me that if it's going to open it up, it's going to reduce the pressure on the heart.
That's a great question, Bob. And beets, like you mentioned, beets are naturally rich in a chemical nitrate, basically. Beets and many vegetables are high in chemicals that we call nitrates. And there's a specific chemical reaction or a chain reaction that you get in your body that changes nitrates into nitrous oxide. And as you're well aware, nitric oxide basically helps with blood flow, and it helps with blood pressure. That's very true. So beet juice is a good way, a natural way that it's effective at helping to lower blood pressure. Okay. And maybe even improve circulation to the brain and to the eye. However, the problem with beet juice, beets are very, very high in an anti-nutrient called oxalates. Okay. And oxalates aren't the best thing in the world for our kidneys. You can get a kidney stone. But if you take some probiotics and drink plenty of water with a little lemon in it, then that would decrease the chance of you getting kidney stones from consuming a lot of beets. So remember, everything in moderation. We looked at this when we were developing Fortify Fit, the ultimate muscle fuel. Doc Hall and I did, and we thought about putting beet powder in there. But since I've had a kidney stone, I said, ain't going to happen, all right? So we used some other things. We used L-citrulline and something called betaine anhydrose. And these two act very similar. They act like a vasodilating effect. They allow more blood flow, more oxygen, more nutrition to the muscles, to the brain, to the eye. And so L-citrulline actually converts to L-arginine. Then that converts into the nitrous oxide. So, and L-citrulline is very safe, and it actually converts faster than L-arginine does. So that's why we put the L-citrulline along with betaine anhydrose into our formulas. But absolutely, I think beets in moderation or beet juice in moderation. I wouldn't do it daily, but if you want to eat beets 3 times a week, as long as you take some probiotics and drink plenty of water, I think you're going to be okay. And I think that's one step in the right direction for anti-aging. Now, beets can also cause gastric distress. And so it can irritate irritable bowel syndrome. So beets are not on the Lange survival diet, but you can eat them, like I said, in moderation. All right.
Very good. Thank you so much, doctors. Have a good week. Lord willing, we'll talk to you next week.
All right, Bob, and Happy New Year. Since we didn't get you didn't call in on New Year's Day, we're wishing you Happy New Year now.
Well, thank you so very much. I think you got a text message from me doing the same to you and your family. Hope things go very well in 2022.
Thank you, Bob. All right, we're getting ready to go to the next call, and then we're going to have some chit-chatting with Doc Hall again. Chris in Tarpon Springs. Good morning, Chris. Thanks for holding.
Good morning. Happy New Year, Doctor. Actually, it's Citrus Springs. Hello?
Hello. Yes. Welcome.
Yeah, I have had some problems with my right eye. I had since last June, June of 2019. I had a replacement, detachment of my retina, and I had the surgery. It didn't go that well. They put the gas bubble in there, But, I had to do it again a few months later, and they put the silicone instead of the gas bubble. I know it would save me a surgery because gas bubble gets absorbed by your system. Anyway, and the second time it didn't work very well, and they said, I had to have a cataract surgery. I did that. So in the past 2 years, I had 4 surgeries with a victorectomy, and still my eyesight on the right eye is not that good. It's distorted. And I do take supplements like B12, fish oil, lutein, over the counter, eye health from my insurance. Anything I can do to better the situation.
Absolutely. So, you've been through a little bit. You've had retinal detachment, 2 surgeries. The retinal surgery precipitated a cataract, and then you had to have cataract surgery, and then you had a vitrectomy on top of that. So you've had quite a few surgeries to your eye, and you're lucky you're seeing, because oftentimes patients after multiple surgeries are blind. So we got to look at the bright side of every coin, Chris. All right, and be thankful for the vision that you have. Now we have to take a protective. We have to take a protective stance to protect the vision in the good eye and to protect what vision you have left in the remaining eye. Okay. So we have to do things that promote overall body health, not just eye health. Okay. So things like cardiovascular exercise, getting down to your ideal body weight. All right. Proper diet, eating the right foods. I would eat a diet consistent with my Lange survival diet. You can Google that, Lange survival diet. And when you go shopping, just buy those foods. Eat lots of those foods. It's going to help the retina, the brain, the joints, the skin, everything. Okay. And there are specific supplements that I do recommend to everybody. If you only took one supplement, a good omega-3 fish oil is very important. The problem is many omega-3 fish oils are garbage. The majority of omega-3 fish oils you buy over the counter have ethanol in them. It's called an ethyl ester molecule. And this can cause gastric distress. It goes rancid and it becomes unstable very quickly. It doesn't absorb well. So if you buy an omega-3 fish oil, make sure it says either triglyceride form, TG form, or RTG form. Make sure it says that on the bottle. There's a few good brands over the counter. Of course, our Fortify Super Omega or our Super Omega Max is. So remember, omega-3 helps with circulation. It helps lower inflammation. It's not going to bring back your vision in that eye. It's not going to, prevent a retinal detachment, but it can keep things working better. All right. It's anti-aging from a nutritional standpoint. Also, you mentioned you're taking lutein. So lutein is one piece of the puzzle, but zeaxanthin is the other piece of the puzzle. So you need to take a supplement with lutein and zeaxanthin, and there's a lot of good ones over the counter. You can certainly look at ours online called Fortify Focus, okay? So those are 2 supplements I recommend to everybody, and then based on everybody's individual makeup and their blood work and things like that and their history, then we can customize, a regimen of supplements even further. But those are 2 that I recommend to just about anybody and everybody. Curcumin is a great supplement also. The problem with curcumin is most curcumin does not absorb well. The newest curcumin that comes from oleoresins is called curcugen, Gen on the neck. So it's next generation curcumin called curcugen. And we're developing a bunch of products with curcugen in it right now. So also, and finally, make sure you see your retina specialist per his or her directions, because they're going to take good care of you.
I do follow up on the appointments. Do you have a store in Ocala?
Oh, we do. And that's Doc Hall. Doc Hall, chime in and let him know about where the Lange Nutrition Center is.
Absolutely. We're located, the easiest thing to say is we're directly across the street from the Paddock Mall, right on College Road. And very, very easy to find. It's a big 2-story building, big sign out front. And it sets back off the road a little bit, big parking lot in front, but it's a 2-story building, so it's easy to find. But we're directly across from the mall, and the actual street address is 3101 Southwest College Road. And very easy to get to. Big parking lot. We have you can come up the stairs, come up the elevator. I'm on the 2nd floor. As soon as you get off the elevator, there's my office, and there's our store. And it's a fully stocked store. We have everything that our main store, our big store, has over in Clearwater. And I'm there every day, Monday through Friday, 9 to 5. Don't close down for lunch or lock up the doors at any time. So you can come by at any time, and I'll be there. If you have questions and like that, I'm more than happy to help you. I spend most of the time out in front of the store showing people products and working on their programs with them. So just come up, and if you have questions, I'm there all day long to help you.
Doctor, thank you very much, and I will visit the Ocala store because I am in Cedar Springs, so it's much closer to me. And thank you so much for the information.
Okay, Chris, you have a great new year, and Doc Hall will look forward to seeing you.
Absolutely. I'll be looking forward to helping you, and you just come anytime, and we can even sit down and go over everything that you need to do.
I appreciate it. Have a happy new year, doctors.
Thank you. Bye-bye.
Thank you.
And for everybody listening out there, that's a free service that Doc Hall does. We offer that at the Lange Nutrition Center. It's kind of giving back to the community. We've been very successful and very lucky to be successful and giving back to the community. Doc Hall, like I said, is an icon in the nutrition industry, in the sports nutrition industry, and he does free nutritional consultations. He'll weigh you in, check your body fat, sit down and go over everything with you. Some people charge over $1,000 for this. It's totally free. And the only thing is, if you buy nutrients or supplements, we hope you get them through us, but that's not a necessity. So check it out, Lange Nutrition Center in Ocala, Florida, directly across the street from the Paddock Mall. 2-story building. You can't miss it. It says Lange Nutrition Center out on the front of the sign. All right, we're getting ready to take the next call. If you got a question, give us a call. You're listening to Ask the Doctors. I'm Dr. Michael Lange with Dr. Richard Hall. 1-877-969-8600. That's 1-877-969-8600. I want to welcome 1040 AM News Talk. It's a new station that we're streaming with now, and everybody on social media as well. You can follow us on Instagram. That's Dr. Michael Lange _. Dr. Michael Lange _ on Instagram. Dr. Michael Lange Ocular Health channel on YouTube. Certainly my Facebook, Michael Lange on Facebook, Twitter, Dr. Michael Lange, and a whole variety of other things, Pinterest and LinkedIn and all those other areas. And certainly you can find out all of that at our website, drmichaellange.com, drmichaellange.com. So before we take this next call, I want you to go to a new website that we've created, and we write up articles on this, and it's simply healthbenefitsofomega3.com, healthbenefitsofomega3.com. And the new article on atherosclerosis and omega-3, you got to check it out. All right, we're going back to the phones. Bob in St. Petersburg, Florida. Good morning.
Good morning, doctors. How you all doing?
Fantastic. And yourself?
Fine, with the exception of my cataracts have caught up to me.
You must be over 50.
I am 78, in good health. I've had good vision, but minor mid-time in my life I wore glasses, but the eyes got better as I reached about 60 back to 2020. But it has reached the point that I need to have cataracts removed. I have appointments for the first 2 weeks in February to have those 2 done, but I got asked the procedure without getting as much answers as I'd like to have. I wonder if you could tell me, is it reasonable for me to expect to have the same quality of vision and focal range and all that from the new man-made lenses?
I'm the cataract crystal ball, so let me look into it. So once again, if you're seeing a competent cataract surgeon, and we're blessed to have tons of them in Florida, all right, the results should be very good. I mean, it's a 5 to 10 minute procedure, topical anesthetic, no needles, a little ultrasound, a little laser, boom, they put an implant in place and you're done. So the question is, are you farsighted, nearsighted, or astigmatic? Do you know?
I was farsighted when I was nearsighted when I was through most of my middle age, but now I am 20/20, and I can also read up close as long as I have a flashlight to illuminate the small print. The size of the print's okay to read, so I'm really lucky that way. So I used to be, but I'm not for the last 15 years.
So let me ask you this: do you still can you read without glasses right now?
No, because the cataracts are filtering enough light out that I can't see the smaller print. If I take a flashlight and shine it on that small print, yes, I can focus on the small print, and then I can look straight out and see 100 yards across, perfectly focused. I can focus far away, and I can focus up close fine.
How's your vision in the distance, Bob? How's the vision in the distance now with the cataract?
Perfect.
It's perfect. Well, you know what?
There's just there's a light filter. There's a light filtering of reduced amount of light getting into my eyeballs. What I see is absolutely clear. I'm no problem at all.
What I tell my patients, when your quality of vision is not acceptable to you and it's decreased to the point that it's affecting your quality of life, that's when the cataract needs to be removed. So, does the cataract really need to be removed?
Yes, the reason is I just learned this 2 weeks ago when I was driving at night. Was the first time I saw the stars around the light of the oncoming headlight of the car, and the amount of that light starring out from that was so bright and intense it blocked out my vision adjacent to that, and it was really unsafe to drive.
Right.
That's what triggered it. I've got to have it out now because I have to be able to drive.
Yep. So
in the nighttime, that interference of the light, that starburst thing, that shut out so much of my vision that I would be unsafe.
Right. So cataracts, the first thing cataracts cause is impaired night vision, glare in the sun. So it's to the point where, that could affect your night vision, especially if you're still doing a lot of night driving. The cataract needs to be removed. So what you want to do, you want to have maximum distance vision. There's three things you can have done with a cataract. You can have a multifocal implant, you can have an astigmatic correction or toric implant, or a regular spherical single vision implant that's covered by your insurance. I would not, just from what I'm listening right now, you're not my patient, but from what I'm hearing, I would not recommend a multifocal implant to you. Number one, it's going to be about $6,000 to $7,000. So it's not all covered by insurance. But number two, it can impair your night vision. If you're, wanting to have really great night vision, you could get rings and glare at night. So if you want maximum distance vision and night vision, you want to either have a toric implant put in that corrects your astigmatism, depending on how much you have, or just a regular implant, a spherical implant that's covered by your insurance. And then you'd wear reading glasses. Okay. So,
well, that's my point. Do I have to wear reading glasses with that, Vince?
Yes, you would have to wear reading glasses with that. Now, you could tell the doctor to correct your eyes for nearsightedness if you wanted. So a lot of doctors would do this. They'll make you nearsighted purposely, say about a -150. That way you can see up close without a problem and on the computer, but then you got to wear glasses for the distance. You can't have it both ways.
Okay.
So you're going to have to determine you're going to have to determine if you want good distance vision or good near vision. Some doctors would do mono vision, one for near, one for distance. I call that half-ass vision. Okay. So
that's what my younger brother has, and he's absolutely 100% satisfied with it. And I work with him now twice a year, spring and summer.
Right.
And he has no problems whatsoever. And he was almost blind before that because the local doctor didn't advise him to get the cataract soon enough. But this specialist, this surgeon I'm seeing, he will not do different focal lengths in different eyes.
Good. Because that's kind of a liability issue. I mean, you can get in trouble driving a car. I would say have both eyes correct for distance. And worst case scenario, if you didn't want to wear reading glasses, you could have one contact on one eye, and that would do monovision at times, just depending on when you wanted it.
No, okay. I think we've answered it. I guess I'll just accept the concept of using reading glasses all the time.
There you go.
And thank you very much. You do a service to the community. Thank you for your show. Appreciate it very much.
Bob, you have a great new year. Bye-bye.
All right. Thanks, sir. All
right. We got a couple of more calls here to take, and then we're going to chit-chat a little bit more. Let's go to John. He's been on hold for about 6 minutes. John, thanks for holding. Good morning.
Yeah, good morning. I want to inquire, please. I have dry eyes, and I'm wondering how much time I should spend on the computer or watching TV. I've cut down my computer use since I've had dry eyes, but I'm just wondering what your opinion is or
John,
your advice.
John, I would say as much time as you want, okay? But we got to treat the dry eye. So the computer will dry your eyes out because you're not blinking enough. Your blink reflex is diminished when you're driving, watching television, or working on the computer. So consciously remember to blink more frequently. When you're on the computer, do the 20-20-20 rule. For every 20 minutes on the computer, take a 20-second break and focus on something 20 feet in the distance and blink 20 times. So 20-20-20-20 rule, okay? That will help.
Okay.
Use a good lubricant in your eye. The problem is most of the lubricants you buy over the counter are just like most of the omega-3s you buy over the counter, not too hot, not too good. So there's two lubricants I like, Optase and Oasis. Optase and Oasis are very similar. It's kind of like Bentley or Rolls-Royce, Lamborghini or Ferrari, right? Which is better? So Optase or Oasis, we have both of those at our nutrition centers. We have them online at fortify.com. You can buy Optase over the counter sometimes, but you can't get Oasis over the counter. These are good lubricants. Take a good omega-3 fish oil, like our Fortify Super Omega, all right?
I'll have that from you as it happens.
Good. Keep taking that, preferably 2 a day. And then what I want you to do is take a hot washcloth or a mask that you put in the microwave and heat up and put this hot compress over your eyes twice a day for 10 minutes. That will open up the meibomian glands and allow you to secrete a healthier tear film. And the final phase is clean your eyelashes really good at bedtime. You can either A, use baby shampoo, which is halfway decent, or B, Optase makes a cleaner called Protect. And you can get it through the stores. You can get it on our website at fortify.com. Optase Protect or Optase Tea Tree Oil Lid Cleanser. So either one of those, you clean your eyelashes really good right before bedtime. That gets rid of the bacteria, viral, and all sorts of germy type flora that hangs out on your eyelashes, crawls into your glands at night, and blocks those glands so you don't secrete a healthy tear film. So it's a 4-step procedure. We heat them, we clean them, we lubricate them, and we nutrify them. And then the final phase is hydration. Plenty of good water. I like Wata water the best, but any good spring water or filtered water, drinking more water is very important because most of us are dehydrated. Then, if you still have dry eyes, I've talked about this. The best drop on the market for dry eye, in my personal opinion, bar none, is called Regenerize, okay? Regenerize has actually natural human stem cell products in it. It's derived from the human amniotic membrane and the placenta, basically. And it works. You use it 2 times a day. I've got patients that have used it 2 times a day for 2 months that had the driest eyes I've ever seen, and they're doing fantastic now. So it's not a miracle cure, although it sounds like a miracle cure, but Regenerize is a little bit more expensive than artificial tears. It's $75 a bottle when you buy 1 at a time. If you buy 3 at a time, you get them at $65 a bottle. You can ask your local eye doctor about it. We have it available, however, at the Fortify Nutrition Center in Clearwater. Doc Hall has it at the Lange Nutrition Center, Ocala. And of course, we have it at the Lange Eye Institute in the Villages, Florida. And then there's other things you can do. You can have punctal occlusion, little plugs put in your drainage ducts by your doctor. That's covered by your insurance. That helps dry eye. It's like putting a stopper in the bathtub. We put a little stopper in your drain in your eye. It takes about 1 second to do. It's painless. And that works at alleviating dry eye symptoms. And then there's certain procedures that get more costly that aren't covered by insurance that you can have done. But if you follow what I just said, I guarantee you're going to do better.
And should I use eye drops before I go to bed? Or not?
Absolutely. You can put them in before you go to bed. If you want the best, then you'd actually get another product made by Optase, and it's called Hyalonite. Hyalonite is a type of an ointment that has vitamin A in it, okay? A form of vitamin A that penetrates the eye and helps increase goblet cell activity. It helps secrete a healthier mucin layer. So that's better than putting drops in at night. It's Optase hyalonite ointment with vitamin A. So think about that too.
Okay, and that's made by Optase.
Optase, yes, sir.
Yeah. All right. Thank you. I appreciate your help. Thanks very much.
All right, John. Take care.
Much appreciated. Yeah. Bye-bye.
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 All right, so we're going to talk about atherosclerosis here. Then we're going to talk to Dr. Hall because the topic of the subject people are waiting to hear about. So, you hear about this all the time. Doctors talk about it all the time. Hardening of your arteries, atherosclerosis, arteriosclerosis. This is a buildup of fat and cholesterol in the linings of your arteries. It's a risk for coronary artery disease. It's a risk for sudden death from a heart attack or a stroke. Where there's new studies out there. There's a great new Swedish study from Sweden that shows that omega-3 in the right levels with an elevated EPA and DHA decreases this plaque buildup, all right? And this was in the Journal of Clinical Investigation, a new Swedish study just published last month in the Journal of Clinical Investigation. So our atherosclerosis is a chronic inflammation in the blood vessel linings. Omega-3 fights against that inflammation and ultimately helps this atherosclerotic plaque. So once again, it's got to have a higher amount of EPA and DHA in it, not low amounts. So you want 1,600 to 2,400 milligrams, 1,600 to 2,400 milligrams of the triglyceride form. There's another study out there showing that the right form of omega-3 decreases the chance of a fatal myocardial infarction. A fatal, that means death, by 35%. There's over 25,000 studies done with omega-3 proving the health benefits. For athletes, it's amazing because it increases muscle recovery, reduces DOMS, improves ROMS, that's range of motion, and DOMS is delayed onset muscle soreness. It decreases joint pain. It's great for your heart. It's great for your brain. So another study shows that if your levels of omega-3 are elevated, it increases your life by 5 years. So the gist of this story is take your omega-3. Omega-3 can help with pain in the right levels. Other things that help with pain are curcumin, astaxanthin, black currant seed oil, black sesame seed oil, ginger, boswellia. All of this can help as well. So once again, if you are plagued with pain and inflammation in your body, you have an autoimmune disease like sarcoid or arthritis, consider adding a triglyceride form omega-3. Check it out on our website at fortify.com. Go to Super Omega or Super Omega Max. Look at the research, look at the studies, and consider adding a good omega-3 to your anti-aging regimen. Remember, the stuff you buy over the counter, the majority of it has very low levels, and it's an ethyl ester molecule that's inferior to the triglyceride form. You can test that by squeezing your omega-3 into a styrofoam cup, and it'll rot a hole through that styrofoam cup in 10 minutes if it's the inferior type. So check out Fortify Super Omega and Fortify Super Omega-3 Max, which is more potent, at fortify.com. That's FORTIFEYE, fortify.com, or call Arlene or Miss Nita at Fortify Vitamins. I'm going to give you the phone number twice. That's 866-503-9746. 866-503-9746. And Doc Hall is an expert, a lecturer, all on this topic on DOMS and on ROMS. And he's been an advocate of omega-3 for years and years and years. And I'm going to let Doc Hall chime in and discuss this in a little more detail.
Absolutely. I was asked just the other day, first of the week, one of the patients came in and was looking around the store, and she says, Dr. Hall, I just got to know, if you just, if someone came in and said, Dr. Hall, you can only take one supplement in the entire store. She says, I'd be interested to know, what would that one be out of all of these that are in here? If you only take one, what would it be? No hesitation at all. It was our omega-3 max. There's no two ways about it. Folks, it's just omegas are incredible, the things that they do for the entire body. It's just not specific to one area or one function of the body and like that. They're just involved in so many things in the body. But you have to watch. the big thing is out now, and I just saw it the other day. One of the companies is advertising, oh, our omega is better because the other guys, and that could be us, just put omega 3s in their formula, but we put omega 3, 6, and 9, so therefore ours is better. It is not. Okay, you get enough omega 6 and 9 naturally, and omega 6 and 9 can actually cause inflammation in the body, and that's what we're trying to get away from. That's what we're trying to do away with. And I want to go back to just real quick with the gentleman that called the caller about the severe dry eye and like that. And just a personal thing. About a year and a half ago, Dr. Lange and I were on one of our famous road trips, and I was complaining about my eyes. I just get eye fatigue in the afternoon. My energy level is always at 100%, but my eyes just took a holiday on me in the afternoon. And so Dr. Lange, of course, he's my eye doctor. There's no two ways about it. So he pinpointed, he said, Doc, listen, you're on a screen most of the day. He says, either a cell phone. He says, you're our team researcher. He says, you're on a computer screen. And when you go home, what do you do to relax? Oh, you watch TV. And so my eyes were taking a beating. They really were. I don't have a prescription lens at all. My vision's fine as far as that, but just the fatigue and the dry eye was getting to me. And so we did three things. I started using a Brooder Mask. That's a mask that you can heat up in the microwave just for a few seconds, and it's gentle heat, not hot, but just gentle heat on the eyes, and which is kind of soothing and makes me sit down and take a break when I do that. So that's a good thing too. But I also increased my supplement Focus, Fortify Focus, from 1 to 2 a day. I take one in the morning and take one in the late afternoon. And also then Dr. Lange fitted me with the blue light blocker lenses. And you'll see me in the store and in my office, and I just wear these glasses all the time when I'm working. And they're very light, and they work. They really do work. When I come to work in the morning, I take my sunglasses off if I'm wearing, and I put my I call them my blue lenses on, and then I go to work. When I come home at night, I reverse the whole thing. And folks, honestly, it took about maybe 2 weeks or so, and my eyes changed around from the fatigue and the dry eyes. So those are three little things: the Brooder Mask, Focus, and also you might want to look into the lenses. And we certainly have those available at the Lange Eye Institute in the Villages. And you can check there. Just a side note, Dr. Lange and I'll be hitting the road again. We have about a dozen stops to make already on the schedule this year, all over Florida and several other states and across the country too. And so the first one we're kicking off is in a couple of weeks. We'll be in Fort Lauderdale, Florida, and the Hollywood area, and for a conference. And so we'll be down there, and we're gonna be on the road again, as Willie Nelson would say. And just one other thing that I wanted to mention is stay tuned for some of the new supplements that we have coming out. They're really groundbreaking. I don't think I've ever been this excited about supplements or about work, to be honest with you. And so we've been spending a lot of time, I'm gonna get tongue-tied here. A lot of time in the lab the last couple of weeks, and really the last bunch of months, and it's all coming together, and I'm very happy about that. It's going to be fantastic, and so stay tuned on that. And I'll go back to you, Dr. Lange.
Okay, Doc, and everybody listening, we're going to open up the phone lines. We're going to take some calls now. 1-877-969-8600. 1-877-969-8600. All right, now I'm going to give you the phone number for Fortify Vitamins and the phone number for the Lange Eye Institute. Fortify Vitamins is 866-503-9746. That's 866-503-9746. And you go to the Fortify website to learn about everything we talk about in this program. Go to the bundle section, because the bundle section is giving you equivalent to 40% off because of the free shipping that you get. So go to the bundle section, look at everything we bundle together for a really amazing deal. These bundles work synergistically together at fortify.com. Fortifeye, fortify.com. Also, the Lange Eye Institute is in the Villages, Florida, right on County Road 101 and 466, next to Publix and next to CVS. Lange Institute is a huge building, looks like a plantation on the Mississippi River. That's where I hail from. Dr. Lori Caputi's there. Also, it looks like we might have another world-renowned expert in a segment of eye care joining our team very soon. And we'll talk about that a little bit more in the very near future. The phone number for the Lange Institute is 352-753-4014. That's 352-753-4014. And since my covenant not to compete is now up after selling all my offices, remember, I opened 14 Lange Eye Care offices in Florida. We had them in Clearwater. We had them in 3 in Ocala, Gainesville, Inverness, Crystal River, Summerfield, Tampa, all over the place. Well, that was Lange Eye Care and Associates. Yes, that was me, but I am at the Lange Eye Institute. So all of you that used to see me in Gainesville and Ocala and all surrounding area, Clearwater, Tampa, you can come to the Lange Eye Institute in the Villages, Florida. That's where I hail from now, the Lange Eye Institute. Also, before we take the next call, I want to mention we have a new vitamin D formula available. We worked on this. It's a great vitamin D formula. It's $9 for 100 servings. So you can do the math. That's not very expensive. So vitamin D is a potent steroid hormone. Everybody's deficient in vitamin D. Many of you cannot go out in the sun because you're either A, albino, B, very fair skinned, C, on a medication that decreases the chances of you or increases the chance of you having problems, or you have an autoimmune disease, example, lupus. And people don't realize that if you have lupus, then the sunshine can actually exasperate it and cause you to have some potential issues. So these people are deficient in vitamin D. So we all need to be taking extra vitamin D. It is very good for you if you can't get sunshine. And I recommend at least 1,000 to 2,000 units. I usually don't recommend more than 2,000 units unless it's recommended by your physician. However, if you're 400 pounds and darkly pigmented, you can take a lot more vitamin D than if you're very fair-skinned and very small. So we have vitamin D in a new gummy. So for your kids and for you that don't want to swallow a pill, it's Fortified Vitamin D Gummy. And we have the new Fortified D in a supplement that you swallow. It's only $9 for 100 of these supplements. Also, remember, we have a vitamin C in a gummy. We have zinc in a gummy. We have the Fit Eyes, which is the eye vitamin in a gummy. And these are very, very good. They're all delicious. All right, phone lines are open. 1-877-969-8600. That's 1-877-969-8600. Give us a call. I want to talk briefly again about the curcumin supplement called CurcuGen. CurcuGen is literally the most bioavailable curcumin on the market. We've talked about curcumins in the past. We talked about BCM95. We talked about nano curcumin. We talked about OmniActive's CurcuWen for many years, okay? We talked about black pepper and piperine and how that can increase absorption of curcumin. But some of these things can have chronic issues if you take them a long time because they have synthetics, and the black pepper extract chronically, if you use it for long term, can cause potential issues. So the company that developed BCM95 has the new CurcuGen. This is the first supplement for curcumin developed from the oleoresins. It's as natural as it gets. It's more closely related to food from turmeric. It has a 52% more enhanced bioavailability than the next best thing. Actually, 39-time enhanced bioavailability, okay? It's got 52% curcuminoids in it. It has a lot of other interesting factors that make it absorb and make it healthier than your typical curcumin on the market. We're having it in 3 delivery systems. We're having it in a gummy that's delicious that I've been taking. We're having it in a dark chocolate that's amazingly delicious. And of course, we're having it in a supplement with just the CurcuGen. And Doc Hall and I are working on the new Omega Relief that will be unlike anything on the market. We've been in the lab testing it. We're on prototypes right now. I got my mom. I got my mother-in-law. I got my daughter. I got my wife. I got Scoobs, by the way, who Scoobs is in the studio with me right now. I've got a whole host of people on some prototypes right now. So we're going to have the new Omega Relief available in the near future. All right, we're getting loaded up some calls. Let's go to, I think it's Tom in Ocala. Tom, thanks for holding. Good morning.
Yes, I'm here in Ocala. I had called the number thinking it was your office number, and I was a little confused. But I did have a viable question. Nobody's been able to answer it thoroughly. What causes blood pressure?
Oh, wow.
Yeah.
You know,
I don't mean to embarrass you.
No.
I have cardiologists and everything else. All right.
Interesting.
Case in point.
Now the music's
Case in
on.
point.
Tom, I want you to take my email down. iDude92, EYEDUDE, iDude92 at iCloud.com. Send me that information. I got some good stuff I can send you on blood pressure. But we're out of time. I wish you would have called a little bit earlier. Okay, Tom?
Hey, look.
All right. And Doc Hall, tell everybody goodbye. We got 10 seconds.
Have a fantastic week, folks. We're glad you stay boring and you tuned into it. Stay positive. Have a good week, and we'll see you next week.
All right. I'm out of here. God bless you. God bless America. Have a great day. See you next week.